Hi, I'm Dr. Ranjani Rao, practicing general dentist and an implantologist in Electronic City, Bangalore. We run two state-of-the-art dental centers in the region of Electronic City. We've been doing this for the last 15 years. I'm a huge fan of immediately replacing the tooth on the same sitting when we actually take out the tooth. Having said that, that's wishful thinking because those kind of ideal scenarios present itself very rarely. So, if you've come with a fracture or trauma and you lost the tooth, bingo, perfect time to put in a tooth implant immediately after removing the tooth. However, if your tooth was severely infected with decay, with infection, or a root canal was attempted but it failed because there was so much infection, which means the bone in that area is already sick and pathologic and there's so much of bacteria. So that definitely isn't the perfect environment in which to put in an artificial implant. So then you do not become a candidate for immediate implant. There are other ways of doing it. We do something called immediate delayed implants, which means we remove the tooth, we've noticed that there's some amount of infection, but we want to give you a tooth at the earliest. We can actually prepare the socket, call you back after a few days, ranging from 2 weeks to 6 weeks, and then go in and put the implant again. The key is, if you manage to put in the implant within 48 hours of removing a tooth, then we have saved, what I again reiterate, crucial buccal bone, which plays a huge role in aesthetics. So if it's your front tooth, immediate implant is your best option. If it's the back tooth, we can still look at delayed implants and we can still give you the same result.